What is psoriasis?
Psoriasis is a chronic skin disorder that occurs when skin cells multiply too rapidly. These cells accumulate to form silvery patches on the surface of the skin. These patches often come and go. The disease can be mild to severe and affects men and women equally. It is a lifelong disorder that usually starts in adolescence or early adulthood. Outbreaks can be triggered by minor injury, stress, infections, exposure to cold and dry climates. Outbreaks can be triggered by minor injury, stress, infections, exposure to cold and dry climates. They can also occur without an obvious reason.
Doctor, what causes psoriasis?
The cause is unknown, but psoriasis is thought to be a type of autoimmune disorder. In these disorders, the body's immune system attacks normal parts of the body and causes disease. Psoriasis is not infectious, contagious or cancerous.
Doctor, what are the symptoms of psoriasis?
Skin lesions are slightly raised, silvery white scales with red or pink margins. Painful cracks can appear. Lesions may be single, in certain body parts, or all over the body. Areas which are usually affected include the skin of the scalp, face, elbows, hands, knees, feet, chest, lower back, and folds between buttocks. Fingernails and toenails are often involved. Itching may be present, and joint pain sometimes occurs. Scratching can cause superimposed bacterial infections. Up to a quarter of people with psoriasis have symptoms of arthritis that worsen when the psoriasis becomes more severe.
Doctor, how is psoriasis diagnosed?
The doctor makes a diagnosis by examining the skin, nails, and scalp. When the diagnosis is unclear, the doctor may do a skin biopsy in which he removes a small piece of skin and sends this for testing to the lab.
Doctor, how is psoriasis treated?
Psoriasis is treatable but not curable. The goal of treatment is to decrease inflammation and control skin shedding. A doctor who treats skin problems, dermatologist, may be involved in care. Avoid things that trigger psoriasis and use prescribed medications to control and lessen symptoms. General measures include good skin hygiene, avoiding skin injury and dryness, exposing skin to moderate sunlight, and oatmeal baths. Treatment of mild to moderate psoriasis includes topical creams, lotions, shampoos, and ointments containing coal tar. These will reduce redness due to inflammation, scaling, and itching. Topical steroids and other anti-inflammatory drugs applied to the skin are for mild to moderate cases and as combination therapy for more severe cases. Other treatments include salicylic acid in mineral oil to remove plaques, pua, psoralen and exposure to ultraviolet light. Immunosuppressant drugs such as methotrexate and isotretinoin, antihistamines, for itching, and antibiotics, for secondary bacterial infections.
What are the do's we should remember?
Do take medicines as prescribed by your doctor. Do expose your skin to some sunlight. Do maintain good skin hygiene. Do keep follow-up doctor appointments. Do avoid skin injuries and dry skin. These can trigger outbreaks. Do call your doctor if signs of infection appear, lesions become worse, or new lesions start even with therapy. Do call your doctor if you see pustules on the skin, especially with fever, fatigue, muscle aches, or joint pain or swelling.
What are some of the dons when dealing with psoriasis?
Don't stop your medicine or change the dose without asking your doctor. Don't exceed recommended medicine doses. Don't use over-the-counter topical steroids on the face or genitals without checking with your doctor. Don't stop steroids or immunosuppressants suddenly, to avoid rebound worsening of